Hello, my name is Kenithia, and I'm a mental health professional and I work in a hospital setting. I will be going over some treatments used for patients with traumatic brain injuries. Next, I will be letting you know some of the ongoing issues with this diagnosis. Therefore, I will be stating a couple of ways to prevent a TBI. While working as a mental health professional, I occasionally see traumatic brain injuries 200 times in 500 patients. A TBI is when the brain isn't working correctly because there has been trauma to the brain. Symptoms are anger, vomiting, abnormal behavior, inability to speak or understand language, and even hemiparesis. Most treatments are short term, but most can be long term. There are not a lot of short term treatments, but we can give nausea medicine for mild TBIs. The long term treatments are when patients have to see occupational therapists to regain balance and speech therapists to help with slurred speech. There will also be a neurologist to see if the patient has improved. The duration of the treatment would depend on how effective the patient is doing performing ADLs, activities of daily living, and having regular conversations without having amnesia. I have a patient who is a John Doe. He is a Caucasian male in his early 40s and is a middle class American. He also has previous medical issues such as asthma. The patient has been diagnosed with a traumatic brain injury. The treatment that the patient will need is therapy and medications such as antihypertensive drug used to lower blood pressure and eliminate urine. While taking care of the patient, you may ask, "Are you in pain?" And they might say no. This may be because of hypoalgesia. In this case, the patient may be given opioid analgesics. A TBI can affect the patients and their loved ones. During this time, there may be difficulty trying to communicate since he or she will most likely have aphasia. You will need to be careful of combative behavior due to the brain injury. We would like to keep patients calm and try to use less brain activities because patients will start to get mad once being asked too many questions and they can't recall the answer. Moreover, keep an eye out for convulsions/seizures. As protocol, we have to do cerebral angiography to look at blood vessels in the brain. We will also do a CT scan of patients' encephalo and cranial. Every TBI patient is different. Some patients may have different cerebral contusions, such as hematomas and subcarotid hemorrhages. Just be aware of these possibilities. To prevent a TBI, wear helmets when riding motorcycles and wear seatbelts while driving. These precautions could help you avoid a traumatic brain injury.